during the coffee break, and Edna. Okay, it's the first section. So let us begin. So good morning, everyone. It is not usual for me to have a paper in my hand during these sessions, but today I will do that, okay? On behalf of Polytechnic Institute of Tomar and the entire BreathIN consortium, it is my great pleasure to welcome you all to the BreathIN final conference. Thank you for joining us today to celebrate the conclusion of our inspiring 3-year journey made possible through the Erasmus Plus program, who we thank also. Today's event is much more than a presentation of results. It is an opportunity to reflect on what we have learned together, to celebrate our collaboration, and to look ahead to the future of healthier and more sustainable universities. So before we officially begin, I would like to invite everyone to take part in a very simple exercise. During the last 3 years, BreathIN has brought together researchers, lecturers, technicians, students, and institutions from different countries. Every one of us has experienced this journey in a unique way, myself included. Before we start, let us all do one thing that has connected us throughout this project. Let us take one slow, deep breath together. Breathe in. That simple act reminds us why we are here today, to create healthier environments where people can breathe, learn, and thrive. So now I invite you to think of one word that best describes what BreathIN has meant to you. Keep it in mind. Perhaps it is collaboration, innovation, friendship, learning, sustainability, inspiration, or growth. Keep that word in mind. At the end of today's conference, we will return to it and reflect on how those individual words have become the collective legacy of BreathIN. It's brief. I'm almost finished. One of the great strengths of BreathIN has been its international partnership. The project has brought together outstanding researchers, professionals from Portugal, Greece, Cyprus, each contributing their expertise, commitment, and enthusiasm. Before we begin today's program, I would like to invite one representative from each partner institution to briefly introduce their team. I begin with Anastasia from Democritus University of Thrace.
Thanks for having me once again in beautiful Tomar. It's a pleasure being here today with you to celebrate the building of this very fruitful project. Today I'm here with no collaborators from Greece, but I believe they are online, so they will have the pleasure to celebrate with us and interact with us. So that's it for now. Very pleased to be here with you, Cristina and colleagues, and looking forward to the discussions.
Of course, Edna from Nicosia University, please.
So, so we are the same what Anastasia has said. I think we are here today, and I am sure that it's the same for Anastasia. So this is our last meeting, yeah? So it's a little bit of a bittersweet moment, yeah, because we worked hard on these 3 years, and then we're waiting to see how is it that we're going to continue. Yes, with me today, as part of the unique team, I actually have Hera, yes, Altonian, and Maria Temistocleus. They are the important people supporting us. So they are the research finance office. The other, I am not going to say like Anastasia said, I don't know if they are online, the rest of the team, but we have been working together throughout these 3 years.
Thank you. And now, last but not the least, Sandra Morato from Polytechnic University of Nicosia.
said, it's a bit of sweet feeling because maybe in person it's going to be the last time that you are going to be together. Folks from Cyprus and Greece. With Cristina, I hope
Not. Yes, collaborate.
Time. Well, I'm here, I think, with lots of colleagues, okay?
Yes.
So we ladies
Adventures of being in Portugal.
being close. So I have here Annabella, everyone, Annabella, João, Andrade, Miguel. You already know all of them, and I have two more colleagues here. There's two students. They are French students from the internship. They are finishing 1 week, and it's Tomar and Menezes.
Yes. And now I want to present also my team, Professor Francisco Carvalho, Professor Rui Gonçalves, Professor Casimiro that is in the backstage with the camera, and the other colleagues that maybe are online with us, and of course, our angel, Rosa that is giving us support throughout this project. Of course, now the most relevant part, because we have in representation of EPT, our Dean of the School of Management here from Tomar, and the floor is yours.
Thank you, Cristina. Good morning, everyone. I think that's the first time I also have some notes to maintain a very short speech, okay, because tomorrow is yours and not so long. So I would like to begin by thanking you all for being here today, and I congratulate Cristina and the entire project team for their outstanding work, dedication, and the remarkable results that they have achieved. Thank you. Within the framework of the Erasmus Plus K82 program, which promotes cooperation and innovation among higher education institutions, this project addresses a topic of great relevance to educational organizations worldwide. It is widely recognized that environmental conditions have a significant impact on work performance and well-being. While numerous studies, regulations, and best practices exist in the field of occupational health and safety, little attention has been devoted to the learning experience and comfort of students within the classroom environment. In this context, the BreathIN project has been truly pioneering. Its findings and outcomes will undoubtedly help raise awareness of the importance of classroom comfort and well-being, while also contributing to the development of practical measures and recommendations that should be considered and implemented in the future. I would like to once again express my sincere appreciation and congratulations to the project team and to all partners, institutions involved. I hope that this workshop serves as a fitting conclusion to what has been a long, challenging, and highly productive journey. Thank you all for your commitment and participation. I wish you a successful workshop and a nice stay at Tomar. Thank you so much.
So now the session will begin, and Sandra, the floor is yours. Thank you.
Hello again, everyone. So I have this task to moderate the next session. And this session, this panel, is called Natural Events Impacts on Outdoor and Indoor Air Quality. Today's sessions brings together 3 researchers whose work addresses issues ranging from atmospheric process and natural hazards to healthy learning environment and international collaborative research. I encourage you to note any questions that arise during the presentations. We will have time for discussion at the end of the session. So it's now my pleasure. Okay. It's now my pleasure to introduce our first speaker. Our first speaker is Professor Ana Miranda, full professor at the University of Aveiro and researcher at CESAM, Center for Environmental and Marine Studies, where she coordinates the thematic line on socio-ecological systems and resources. Professor Miranda has more than 30 years of research experience in air quality, climate change, forest fires, urban environments, nature-based solutions, and environmental health. She has coordinated numerous national and European research projects and has made an outstanding contribution to environmental research through an extensive scientific publication record and the supervision of many master's and doctoral students. Today, Professor Miranda will present the effects of land fires on air quality. Professor Miranda, the floor is yours.
Só consegue partilhar.
So let's just. Good morning, everyone. I suppose that you can already see my slides.
No,
Yeah,
not
but
in a minute, please. Tem que ser ela a partilhar. Tem que ser ela a partilhar. Professora Miranda, por favor, tem que ser a professora a partilhar.
I'm sharing.
Ok, mas estamos a ver a parte do apresentador e não a apresentação propriamente dita.
Eu vou parar de partilhar e vou partilhar de novo, está bem?
Ok.
E agora?
Não, continuamos com o mesmo. Tem que partilhar o modo, o ecrã de apresentação e não o seu ecrã. Isso.
Já está?
Maravilha.
Okay, ótimo. So, good morning, everyone. Sorry for this sharing little problem. Thank you very much for the invitation to be here online. I'm sorry I'm online. And thank you for the invitation to share some experience and some results regarding the effects of wildland fires on air quality, which is a very important issue in Portugal, but also in South Mediterranean countries. So I'm not the only one. I'm doing the presentation, but I'm working with other colleagues. I'm coming from the Department of Environment and Planning from the University of Aveiro, a little bit to the north of Tomar. And we are worried with wildfires and air quality, not only in Portugal, but because this is affecting different regions in the world. And this is affecting cities, urban areas where the population density is higher. And so the human health effects are going to be more pronounced. What I have here are just some examples. I have here Aveiro, where I'm coming from, affected by smoke from wildland fires that were spreading near the city. Then you can look to Sydney, Australia. Again, the city was full of smoke. São Paulo, Brazil, New York, and we can include here some more cities and some more problems related with smoke. Still in Aveiro, and this particular case affected us almost directly in September 2024. And you can see that, at least in Portugal, the fire season is extending. So we are having fires in the spring and also in September and October. This is one example from September. And this is how Aveiro wake up in this particular day. So a large smoke cloud was arriving to the city. This is a picture from my office in the morning. And this is a picture in the center of the town. This is the sun. So everything was plenty of smoke. And when we looked to the measurements of concentrations of, in this case, particulate matter in the air, we can see very clearly the effect of this wildland fire that was near Aveiro. These are daily averages. The daily limit value for the protection of human health is 50 micrograms per cubic meter, and then you can have one idea about what was happening. And this is because wildland fires are emitting several compounds to the atmosphere. You can see here particulate matter, PM10 and PM2.5, but also gases, and they are going to affect the atmosphere at different scales. We can talk about climate change. We have emissions of carbon dioxide, nitrous oxide, methane. Then we have effects at the mesoscale or regional scale, and we have photochemical pollution with ozone and also particulate matter pollution. And we can have acute air pollution episodes, like the one that I was just mentioning in Aveiro. And the worry is about the frequency of this type of events, the intensity of these events that are increasing under global change scenarios. And this is going to have health effects. And we can talk about acute effects like eyes, irritation, breathing difficulties, headaches, dizziness, nausea, but we can also have long-term effects. And we can even talk about cancer. I have a question mark there because it is not proved yet, but there are a lot of evidences that probably wildland smoke is going to provoke cancer at long-term issues. And so for the protection of the human health, there are air quality limit values based on European directive. We have guidelines from the World Health Organization, and those are short-term or long-term oriented, and I'm going to focus mainly on short-term effects, which are based on hourly or daily values depending on the pollutant. So the first point is, can we assess the smoke that is coming from wildland fires? And yes, we can. And we are used to work what I call a chain of events. So we start with emissions. So what is emitted by these fires? Then we move to concentrations in the air. And then we try to address human health, going to exposure, to dose, and finally to the human health effects. And starting with emissions, we can assess them, measuring. We can go to the lab and measure what are the emissions of the burning of vegetation. We can go to the field and sample these emissions. We can do measurements based on aircrafts too, and we have satellite techniques. For instance, for the sampling at the surface, a lot of measurements have been done here in Aveiro. This is one example of the type of equipment we use. In particular, here you can see this gray filter is because of the emissions from smoke. It was supposed to be white. And as you can imagine, this could be very dangerous. So this is one photo of the sampling just near a wildfire event. And we have to be very, very careful when we do this type of measurements. And based on the measurements, we can estimate emission factors. The emission factor here is the gram of pollutant emitted by kilo of fuel burned. And these are just examples that were selected for South European areas. The emissions are going to be different if we are considering the flaming stage or the smoldering stage of the fire. And based on the emission factors, we can calculate emissions. So what I have here is one example. We calculated emissions using a bottom-up approach, so using data from the field mainly. We knew in advance the ignition location and type of time of the fire. We selected the emission factors. We had information about the propagation of the fire, the burn area, the fuel load, And we selected the fires that were burning in October 2017, which was a very big event in Portugal. And based on the information that we had, we were able to calculate emissions using this very, very simple equation, which is used nowadays quite regularly. So we have the emission factors, then we know the burn area, and then using the fuel load and the burning efficiency, we can calculate emissions. So we apply this equation and we calculate emissions with the spatial distribution of 500 meters per 500 meters, which is quite good because usually the emissions are calculated with a much coarser resolution. This is one example for PM10 emissions. But what I really would like you to take a look is to this comparison, because usually we look to the values, we look to the map, but we are not really sensing what is there. And so here we have a comparison between the emissions from these wildfire events and anthropogenic emissions. Here we have only the period of the wildfire, and for the anthropogenic emissions, we have the entire year. And we have different pollutants, PM10, PM2.5, nitrogen oxides, and so on. And see that, for instance, for PM10, the emissions of these events were higher than the anthropogenic emissions in an order of 2.7. This value was even higher for PM2.5 and even higher for carbon monoxide. And so we can understand the contribution of these emissions to what was happening in Portugal at this period. And then, because we are not briefing the emissions directly, we are briefing the concentrations in the air. So these emissions are going to be dispersed and transported in the air. Then we have to go to the concentrations in the air. And for this, we are used to apply models. We have different types of models, different approaches. We can use Gaussian models, which are very simple, Lagrangian, CFD models, chemical transport models, and we use them depending on our purpose and on the scale that we want to address. So this is one example at regional scale. This is for Greece. In 2021, in August, there was a very big event which affected Athens. And so with the help of some colleagues from Greece, we applied a chemical transport model, which is called CHIMER. And it has a module just for wildland fires. And so we calculated, and I'm showing you again PM10. The resolution is coarser, so we are now using 5 kilometers per 5 kilometers and around Athens 1 kilometer per 1 kilometer, because we are addressing the regional scale, and you can have one idea about what was happening in this area during this wildfire event. We compared because when we are modeling, we always want to compare our results with measurements. And here there is the comparison for a particular monitoring station, Coropi, for PM10 and for ozone. And you can see that there was an issue here, mainly related to the time of the event for PM10. But results were very reasonable. And you can find more information in this publication if you are interested on. We have made something similar to the fires in Portugal, October 2017, and we were also including anthropogenic emissions and natural dust events. And we had an event coming from North Africa during this period. So it was quite worrying because we had the emissions from the fires. We have this dust event. And so the values were really, really high. And you can see again the hourly distribution in the country, over the country. And again, the comparison for a particular monitoring station in Portugal, for PM10 and for ozone. Then we move the scale. We are coming to the local scale. So look to the resolution, to the spatial resolution is 5 meters per 5 meters. We are using a different model. It doesn't account with the chemistry. It only counts pollutants as passive pollutants. And it was validated based on an experimental field that was done in the central part of Portugal. We had a monitoring lab measuring the pollutants, and we applied the model and we compared our results with the measurements. So if you look here to the IDAD, is the location of monitoring station, and every time the color is similar, it means that results from our modeling were similar to the measurements in this monitoring lab. Then exposure, and I'm not going to show you results of exposure, we have them, but I only want to think with you about are we exposed equally? So we have the concentrations in the outdoor air, but are we really exposed to these concentration values? Are we outside? Are we inside? So that's the purpose when we are calculating exposure. And so for calculation of exposure, we have to take into account the activity profiles of the people. We have to look for vulnerable people, and we have to carefully look to the concentration distribution of pollutants. And the equation we are used to work, it could be a bit complex than this one, but this is the basics. So we have different population groups, and we know their time profiles, activity time profiles. We have the concentrations in the air. We have the time spent by the different groups in different places, and then we calculate the exposure. And then we have to communicate, because our last worry is about the human health effects of this smoke. And if we want to prevent and to decrease the human health effects, we have to communicate. And we can use this type of information, so air quality indexes, and depending on the level of the index, we can inform population about what they are supposed to do to reduce the exposure to the pollutants. And finally, we don't have this yet in Portugal. I took this from some North American sites. And North American people and Australian people, they are really trying to address this wildfire smoke. And so they have some information how to minimize the effects. So for instance, to look to the air quality index, to limit outdoor physical activity, to stay indoors as much as possible, keep doors and windows closed, use air conditioning if available, and go to places that have air conditioning again. So this is the type of thing that we are trying to have in Portugal and in Europe too. And because we want to help protecting people. And just to finish, when we had this 2024 wildfire smoke event in Aveiro, I was coming to the university in the morning because we were not aware yet about this issue. But when I was coming back home at the lunchtime, I was watching people running, doing exercise. I was watching kids doing activities outside, and I was really, really worried. And that's why we are trying to help protecting people. This has been done and is under development under this national project, which is called Large Fires. And so thank you for your attention. If you want to contact me, my email is over there. And thank you for your attention. If you want to ask something, just feel free for doing this. Thank you.
Oh, now it is.
No, okay. So now I think we should go.
Yes, if you want.
The end, if you don't mind, okay, if you can be with us until the end of the session.
Just sorry, the session is going to end at what time? I was supposed to know, but
we have 2 more presentations.
Yes.
okay, thank you.
Okay, so our second speaker is Professor Cristina Andrade from the Polytechnic University of Tomar, where she is professor in the Department of Mathematics and Physics and founder and director of the Natural Hazards Research Center. Professor Andrade's research focuses on natural hazards, extreme events, climate change impact, and environmental modeling, and she is the principal investigator of the BreathIN project. Today, she will present outdoor to indoor propagation of particulate matter during wildfire and dust episodes in naturally ventilated higher education classrooms. Please, Cristina, the floor is yours. Thank you.
Okay, thank you. And my communications is more or less a follow-up of Professor Miranda. Since we have the monitoring equipment installed, I am only going to show you some preliminary results related with the outdoor, indoor propagation of particulate matter, okay? So our main challenge was why indoor air quality matters. Like Professor Miranda told us, we must raise awareness regarding these issues because we need to prevent ourselves of becoming ill, since the air quality outdoor is not always good for us and for certain activities like exercise, and people who have allergies or asthma or other issues can be affected and seriously affected. So one of the main targets of our project is indeed to raise awareness. And when we talk about outdoor air quality, we must think about indoor air quality also, because of course, though the pollutants that we have inside and the pollutants that we have outside may be different, there are some common grounds, namely the particulate matter. And my communication today is going to be focused on PM 2.5 and PM 10, okay? So one of the main purposes and objectives of our project was, like I told you, raise awareness, but also to develop skills, not only among the faculty members, but also the students, because you are going to a working environment, and if you are aware of these issues, you can talk about them and educate your colleagues, your fellow colleagues. But also our aim was to introduce some eco-friendly and green practices. You are going to hear in today's session a communication from Professor Edna regarding these issues, and of course, best practices, and I'm going to show you what is the meaning of a living lab right from 1 or 2 slides now. Okay, so another aim that we had was to propose a roadmap for sustainable indoor environments. So in our case, we have 2 lecture rooms here in Tomar that are being continuously monitoring, and these rooms have certain characteristics. This room here, B268, is an interior room, is an amphitheater, and is an interior room. So the doors and the doors are towards indoor corridor, but the windows are to outside. In the lecture room 102, the door is directly exposed outside. You can see here that is facing outdoors, and also the windows are facing the exterior. So here we had in mind, can 2 naturally ventilated classrooms exposed to the same outdoor environment behave completely different? And we are going to see the results, the preliminary results, okay? Well, since we have students here in the auditorium, I have the concern to show you the difference between PM 2.5 and PM 10. So you have here PM 2.5, very small indeed. You have here PM 10, and in comparison, the pollen from 10 to 100 micrometers are relatively larger, bigger than the ones that we are going to discuss here, PM 2.5. Here you have a human hair, so you have the comparison. They are very, very small indeed. And what is the main reason for me to show you this? Because since these are considered fine particles, they can penetrate deep into the lungs. So this is a factor that might be taken into consideration. Though the PM10 can affect the upper respiratory tract, these ones goes deep inside your lungs. So now that we are aware of what we are going to analyze, we also have 2 ways of monitoring: the outdoor air quality monitoring, okay, and the indoor air quality monitoring equipment that is installed in these 2 lecture rooms. So now we have had in 2025 4 major events that I am going to show you the results and the impacts that we have had here, okay? So there were 4 major dust events, one bigger than the others, but on April 9, dust-related episode, on May 13th, and in June and August. The June was the most severe, and also in August. But here we have another thing. I have collected data from our forest SGIF records, okay? And we have mixed events. We have simultaneously dust events along with large forest fires. You can see the total burned area from the 7th to the 10th was above 60,000 hectares here in Portugal. One of the things we did not take into consideration the locations, okay? It was events around Portugal, but we know that during August, during this period, the huge fires were concentrated in Serra da Estrela, okay? So what I am going to show you is not all the data that we are gathering from this equipment, only PM 2.5 and PM 10, okay? Three main outcomes rise from this preliminary research. Outdoor air strongly controls indoor air quality, room geometry determines indoor exposure, and outdoor episodes produce different indoor responses. Let's take a peek to what we have seen. So one of the main things was, despite being naturally ventilated, both classrooms respond rapidly to changes in outdoor air quality. I do not know why the graphic is not appearing. Yesterday it was working fine, but today is not. And here you could see that the episodes were mostly felt in one of the two rooms. Let me try to see if in another slide these results show. So we have correlations around 0.9 in one of the rooms and lower in the other room. And what was most surprising was, though the correlations are high, one room is much higher than in the other room. Can you guess what was the room that the correlations were much higher? The indoor room, not the outdoor exposed room, but the indoor room. Yes, it was surprising even for me. So indeed, outdoor air quality matters. And I will stop sharing because the images, Casimiro, can you help me here? Because the images are not appearing and this is not good.
Okay, let me see.
Try to see if the link is working properly. My apologies. Again, the Murphy's Laws.
Só aqui ver uma coisa. Aqui.
Refresh.
Não. Ir no browser. Não sei qual é que fizemos da outra vez. Foi.
Sorry. My apologies, but sometimes these things happen.
Aqui.
Okay. No, that's it. Pode. Okay. So my apology because the link was not working properly. So the second outcome was how the geometry of the room was the keen problem here. So you can see here the room 102 with direct outdoor exposure has an indoor-outdoor ratio of 0.39 for PM10, so the coarser, and the finer particles 0.65. But if you see the ratio of B268, the ratio is much higher. And when we try to analyze what was the percentage of attenuation, so if you open the window, open the door, some kind of ventilation, the attenuation here at the room that is directly exposed is much higher than the other one. So one of the things is Here we can see the results of an effective dilution and particle removal, while here we have particle retention and resuspension. This means that when the cleaning ladies clean, they do not clean the dust. The dust goes up and then goes down again and does not leave the room. So we named this room the dilution room and this one the retention room. And I have here a picture that can illustrate the effect that we had observed. So we have here a fast air exchange that promotes the removal of the particles, both type of particles, while here, no, the low air exchange rate is much lower, and then we have resuspension and we have retention of dust. And of course, this has a great impact, and this is our third outcome. Outdoor episodes produce different indoor responses. Yes, they do. And when we take a look of these numbers, we have here 7% increase for PM 2.5, while we had a 104% increase in the indoor room. And when we talk about the PM10, we can see we have a 72% increase inside the lecture room that is facing outside, and 105% increase in the PM10 particles for the one that is facing indoors. So this can be also depicted, the strong correlation can also be depicted, because here you have the daily data of what? In blue, you have the outdoor monitoring equipment. You have in green the room facing inside the indoor room, and in orange, the one that has the door facing outside. So you can see why the correlations are high, because you have almost a replication of the behavior that we see outside to the inside. Now, another thing that we have had here, these bars are the burning area in Portugal for those days, okay? You have here the huge peaks that you have that we have observed during the wildfires in Serra da Estrela. And here, this is raw data. We did not have into consideration the locations, the winds, nothing. This is only raw data. But you see here that even with a delay, we observed 2 days later a peak here in our monitoring equipment. We have a high correlation between these events. So let me remind you, we have dust events here, dust events, okay? We have mixed events, dust and wildfires. And here we have the huge events of both wildfires and dust events, okay? So this is for PM 2.5. Now, for PM10, the much larger particles, okay, again, the behavior is similar, they replicate, but see the effect of resuspension. You have here much lower indices of PM10 inside, so the peaks are almost identical, you see, but the levels are much lower. And inside B268, the values are almost as equal as the ones that we have observed outside. So this is very interesting. This is very interesting and gave us more or less 5 key takeaways. Outdoor air quality strongly influences indoor air quality in these rooms. Room geometry and ventilation design are decisive. Direct outdoor exposure does not guarantee lower indoor pollution. And of course, Next steps, expand this experience, this living labs network, development, implementing training programs, because this is very important for you to be aware of these matters. And of course, we are going to publish the results beyond the lifespan of the project, but this is very, very interesting. And of course, one of our project's main goals was to propose roadmaps towards sustainable indoor environment. So just headlines, we should understand the building, we should monitor indoor air continuously, we should consider outdoor conditions. So when we know if there are dust events or wildfires, we should shut the windows and not open them, or only open them, but try to understand if the ventilation is the one correct, or so to speak, optimize natural ventilation. Take into consideration that different rooms need different strategies. So for the room B268, the indoor room, I propose HEPA filters and vacuum, not dust with the cloth, but vacuum, okay, the room. While O102, we must regularly open doors and windows to make a draft strong enough to remove the particles that are inside. And of course, nature-based solutions. So, recommendations. We will produce some recommendations. We have here a little summary regarding this study, but they can be implemented by other higher education institutions. Assess room-specific ventilation characteristics, monitoring, implement target interventions, educate occupants, and consider mechanical ventilation for retention-prone spaces. One of the things that I would like to tell you was in line with Professor Miranda. We should always be aware what are the conditions outside, and you can do that because one of the things that we have is the monitoring equipment outdoor. It is free of charge. You can become a subscriber. So I invite you all to download the app to your mobile phone. And if you have health issues, or even though if you do not have health issues, you can consult, because here you have the pollutants, the state, the air quality, from green to yellow. So today we are going to have yellow periods with particles in suspension in the air. And here you have also the main pollens that are prevalent for today and along the day. You also have here the forecast for the next days. So you can continuously know what is going to be the air quality here in Tomar. And you can access, of course, the worldwide network and other places. So this is what I wanted to show you from our results, preliminary results here from Polytechnic Institute of Tomar. Thank you for your attention.
And now we're going to our third and final speaker of this panel, is Professor Edna Yamasaki. She is director of the EH Research Center at the University of Nicosia, a research focus on public health, environmental health, and neuroscience, and she has been actively involved in several national, internationally funded research projects. Today, she will present the BreathIN project at the University of Nicosia. Please welcome Professor Edna. Yes.
English. Isso. Muito bem. Obrigada. Yeah. Então, bom dia para todo mundo. Yes. So, good morning to everybody. My presentation is going to be very different from the previous speakers. And I would like to tell you then what is our experience within this project at our university. Yeah. So allow me to do also a little bit of a reflection on our past throughout this project. So the first one then is, how did it start? Oh, it doesn't change. How did it start? I got a telephone call from the Erasmus office. There was a professor from the Institute of Tomar, and that she was actually interested in coming to the University of Nicosia for an Erasmus exchange. Yes, and this was 2022. From there on, we started talking, and then she comes and say, "Oh, Edna, let's go and participate in, let's put together an Erasmus proposal." And there we started working. She had Sandra. We had at that time some people from Poland. Yes. And then Anastasia joined us later on. So from those beginnings, we had a lot of rush because of the way that the project started. Our kickoff meeting was online. And then finally, we had also our first meeting then, and it took place physically in Cyprus. Yes. We did a symposium. We had people from the department. It's going by itself, sorry. We had people from the air quality services from the government, yes. And so it was a symposium, and we also had a workshop. Yeah. So these are just some of the activities that we did. Yes, we got to know the partners that were able to get together. I like this very much because I think this is the magic man. So making magic and showing them this to the students and to the audience that was there. And very important, we needed to get together and get to know each other. I think, Anastasia, you couldn't come at this time, so you were represented by our own. It is going automatically. I don't know why. Huh? It's just passing automatically. And anyway, so we even had a vegetarian there. And for us to go on a Menezes and then to cater for vegetarian, it was a big of a challenge. So we did, yeah. And then we had to start our interventions, which is finding the plants, which classrooms to choose. So finally we chose, this is my apologies because it's going by itself. Yeah. So we chose 2 sets of classrooms, or 4 classrooms, 2 that had windows and 2 that had no windows, just artificial ventilation. And we started a very good partnership with this company. We ran a series of workshops, yes. So the whole point was to make students interested and to make them know about it. And so life and health, and then we also had students from engineering, yes. And this was our last event. So we decided then to do a workshop, tell the whole university community, tell the whole university community how important were the plants, how to take care of them, what were the plants, so they actually could check which were the plants, what was it that they were actually filtering, yeah. And we actually made a very interesting partnership with the Cyprus Anti-Cancer Society. Yes, a lot of these pollutants, they actually are, they cause cancer. Yeah, so we partnered with them. So we actually we collected some money and it was donated to the association. Yeah, so I think this was a very interesting outcome. And we also ran a roundtable where we got policymakers and we also got the specialists in air pollution. Yeah. So this was then the last event that took place early this year. So these were some of the activities that we did throughout this project. And then I was just adding here, what were the presentations, what did we do towards the project in the meetings that we had. So Susanna presented 24 and 25, and then we had Loizos and Ernestos. So they did a presentation last year in Leiria, and they actually had a poster. So this is important because this is also student involvement. It's the work of the students that we're doing that allowed us to contribute. Yes. This was the first a pilot study. This was a high school student. So Elena, together with Elena, so they were actually evaluating the classrooms at the university and looking at different characteristics. Yes. More recently, what we have done is we have so two medical students, Amir and Eleanor, and a human biology graduate now. Yes. So they presented actually last year the evaluation of what is actually happening in the different classrooms that we were monitoring before and after intervention. And this is going to be then a paper that they have written and we have submitted it. Right now, what they are doing, still part of this project, we got from the different institutions, the questionnaires. So we were going to use before intervention. Yes. So we are going to look then at the respiratory symptoms of this taking from the questionnaires, and we are going to compare it within our 4 institutions. So this is a continuation of the students' work. So I think very important then for us was that we got people involved. We got an association, a cancer association involved. We got the policymakers, and most important, we were able to get students on it. Yeah, so I think this is actually a very good outcome for us. Yes, I just put together here. So the students know now about air quality. They go and check the monitors and they say, oh, what should we do? So they are aware. So we actually achieved this. Yes. They show the plants also, and with our workshop on the plants, I think this was actually they liked. And what we get is thumbs up for, oh, the plants are amazing. So we have even to look that, even though we found that after we put the plants, indoor air quality did improve, but there was also the sector, they felt well, so the well-being aspect of it. Yeah. So they are aware then about ventilation, how it is important. We got the students involved. And the last part then is that we actually were able to get people involved, stakeholders involved in this project. This is my last slide. Yeah. So this is a bit of, we are the super women in the project. Yeah. And how important it is actually for this kind of network. It's not only hard work that we do, yes, but actually enjoying and taking the time together. Yeah. So thank you.
pictures. Maybe some of them should not be presented, but okay. And okay, so I think we've finished our first panel, so it's time for the discussion. So who wants to break the ice and make the first question? Has everyone?
Yes. Yes, definitely.
Okay. So ask questions.
Que a nível europeu, em todo o passado, mais de 10 mil pessoas morreram devido à má qualidade do ar predominante nas cidades europeias. E a minha questão é, tendencialmente, pelas alterações climáticas, que vão ser traduzidas em realmente aqueles fenómenos extremos do inverno que destroem todo, digamos assim, o parque natural verde nos vários países. Depois, no verão, em resultado dessas alterações climáticas, temos a questão dos incêndios, que é outro contributo para a má qualidade do ar. Então, a minha pergunta é se, tendencialmente, não vamos estar mesmo condenados a que, ano após ano, esta qualidade do ar se vá degradando e aumentar o número de mortos, quer no país, em Portugal, quer no contexto europeu e até mundial.
E quer fazer essa questão a algum orador em particular? Em geral. I think Anastasia, maybe it's the only one who doesn't understand the question. So it was a question related to if the number of the toll death due to poor air quality is going to increase in the next years in Portugal, Europe, and worldwide, maybe due to climate change and all the consequences from that. So the question is, are we going to see for the future this problem increasing? So wants to answer.
Thank you.
Maybe Anastasia? Oh, well, this is a difficult question to answer, actually, because there are a lot of changes, weather-wise, but also emission-wise. And this is actually what we are trying to produce in our next paper. We are trying to study how different stressors, such as the wildfires, are going to affect public health, but also indoor health. There are a lot of different variables that need to be taken into account. So it's not only the climate scenarios that we have to study, but also the different habits of the population, adaptation by all means. For example, adaptation like the behavioral one, such as the things that Cristina mentioned earlier, how good we are in listening to the bulletins or how seriously we take them. So yes, there is going to be change. This is unavoidable. But this does not necessarily mean that the situation will be worse for public health if we all adapt in the way we have to, like taking into account the bulletins and listening to specialists and what they have to propose to us. So the short question is, yes, there are going to be changes, but this does not necessarily will reflect public health in an adverse way. Or if you want to do the translation.
I think you understand our question. And maybe Person Miranda, I don't know if you want to add something.
Yes, please. Thank you for the question. For Europe, what we are seeing is the decrease of the concentration levels in the air. So the trend is for a decrease in the concentration level. So a slight increase in the air quality, even in cities. but this is not enough. This is related with the measures and the policies that have been adopted to improve the quality of the air, and there were several. I hope we are not going back in these policies. But what is happening is this is not enough. Based on the World Health Organization guidelines, this is not enough, and we still have to work a lot. Then we have another issue that I was speaking about, which is the natural events, and those are more difficult to control. So regarding wildfires, I'm not very confident about the future. I think we are going to have more events. We are going to have more cities full of smoke. And we have the dust events coming from North Africa, and they are affecting also the quality of the air. And we are not really knowing what is coming with this dust. So there are some worries about even the biological composition of these dust events. And regarding climate change, well, if we look only to climate change without thinking about policies, then the scenario is a bit worrying. But when we look to climate change and policies regarding the reduction of emissions to the atmosphere, the scenario is not so critical. But I'm not so sure, but I hope my colleague Joana Ferreira will speak a little bit more about that in the next session. So the scenario is not very, very black because things are improving, but we still have a lot to do. And this depends on us mainly, because when I look outside and I see the number of cars still on the roads, and I see our behavior, I think this depends a lot on communication, awareness, and change of behavior. And thank you. I don't know if I answered, but I tried.
I just add one thing. So I think another thing that is important to be considered is actually the population. Yeah? Are we getting healthier? Yeah. If you look at data, now we are getting more obese. We have very bad life habits, and this would be a very important contributor to if we're thinking about increased number of service death. So the human factor is also very important.
So, there any other question? Okay, I had one, but I think we can leave it to the round table because we are a little bit short on time. So I will thank Professor Miranda that she's online, and I also thank all the presenters from this panel. Now we are going to the coffee break, yes, and we'll be back in maybe 20 minutes, 25 minutes for the next panel. So thank you all.
Thank you.
Thank you. Bye-bye.
Our session is already ready for you to take.
Quer dizer alguma coisa, Edna?
Okay?
Sim, queria testar só para ver se isto funcionava. Desculpem.
Okay, Edna.
Só que vem aqui o colega já aqui vai.
Tá bem, obrigada.
Casimiro is going to take care of it, okay?
Olá, Edna.
Olá,
Estás
bom
boa?
dia. Está tudo.
Nos víamos há tanto tempo.
É verdade.
Opa, eu quando vi que estavas no programa, disse assim, olha, eu preciso isto. Então vá, olha, ele depois já vem aqui falar contigo, está bem? Para
Ok,
organizar.
obrigada. Obrigada.
Tá.
Um beijinho.